Clinical depression exceeds sadness. It's more than a terrible day or losing a parent, grandmother, or pet. It's also not a flaw in my character. Clinically depressed youth cannot snap out of it. Depression affects 1 in 33 children and 1 in 8 adolescents. 2/3 of mentally ill youngsters receive no treatment. Suicide ranks 3rd for 15 to 24-year-olds and 6th for 5 to 15-year-olds. Depression impacts the brain and body. Depression impacts thoughts, feelings, and behavior. Childhood depression can lead to academic failure, drug use, and suicide. It's easily treated. Childhood depression has 2 myths. The first applies to adults and children. This myth holds that depression may be overcome. Clinical depression goes beyond blue. Everyone gets down. Stress or dissatisfaction may cause this. Depression is more pervasive and life-threatening than these negative feelings. Clinical depression doesn't start with one event, either. The second myth is that children have no cause for depression. Children are carefree. Adults forget that youngsters are helpless. Peer acceptability, school, and parental expectations are also issues for kids. This is difficult to deal with on a daily basis. Girls are twice as likely as boys to suffer depression in adolescence. Childhood depression is difficult to diagnose. No test can confirm depression or identify its causes. Studies have demonstrated that certain children have risk factors that could trigger depression. Risk factors include 1. Smoking. 2. Parental or family death. 3. Attention, conduct, or learning difficulties. 4. Diabetes. 5. Other traumas, including natural disasters. Some infants show depressive symptoms before most of these elements, so some children may have chemical depression. Researchers believe children inherit a propensity to sadness and anxiety, but environmental triggers are needed to cause serious depression. Genetics and family history can influence a child's depression. Childhood depression is linked to uneven parenting, traumatic life events, and a pessimistic outlook. Research reveals that parental irritation and withdrawal cause children to have low self-esteem and sadness. A family history of mood disorders and other mental illnesses is linked to childhood depression. A child's risk of depression increases if a parent has childhood or recurring depression. Depressed individuals report increased childhood neglect, abuse, rejection, and family conflict. At the time of initial examination, 30 to 40% of effectively unwell children have a biological parent who is also effectively ill, usually depression. Depression causes vary by child. Depression may be chemical, psychological, or both. Treating the ailment is more important than finding the cause. Autism is caused by brain abnormalities. To understand problems, scientists analyze normal brain development. Brain development continues after birth. Researchers have found various brain development issues. However, diagnosing and treating issues are tough.